I've been working with medical students for almost 10 years now at the University of Miami, really watching our students start from day one towards graduation, where they really become amazing, competent physicians that are ready to tackle any patient is really amazing and rewarding. Our students not only are clinically competent, but to see them really advocate and to really focus on social determinants of health is really something that is very rewarding.
I had the privilege of working with the internal medicine residents at Florida Atlantic University. And the greatest privilege is the ability to transmit knowledge as well as share experience and teach them things such as ethics. And also, besides knowledge, you have to have respect for the patient and treating the patient as if they're your family.
With my work with the trauma agency at the healthcare district, I do over 100 presentations a year on teaching people how to be safe. One program I've been focusing on is called Stop the Bleed, teaching people what to do if someone gets injured. This program is very special to me and very important to me because I know that power is through knowledge.
Okay, so many years ago, after arriving in this country, my brother was run over by an automobile in front of our house and was taken to a local hospital. The doctor saved his life, but they didn't have the time to talk to my mother. All they said was, "We'll see, time will tell." And I remember the impotence my mother felt at that time and her face. And that day I decided that I would become a doctor, that I would, if I did become a doctor, that I would spend time talking to patients and families, demystifying their illness.
I am a nurse and diabetes educator at Jupiter Medical Center. I became involved with diabetes education years ago when I started my career on an orthopedic unit. I saw a number of patients who had lost a toe or foot to diabetes, and many of them would ask me, if my feet were so important, why didn't someone tell me to check them? To me, I could not understand why they hadn't received basic diabetes education. And to me, patients who are able to receive the education are able to make a difference in their outcome.
I'm a pharmacist. I help train close to 70 pharmacists every year and close to 30 medical residents. I help them select the right medication to optimize patient therapy. And that's very important to me because I can make a difference in people's life and I can make them heal better.
As a board-certified ophthalmic surgeon, I know the value of improving and restoring sight for thousands of patients. I realize that there is a severe nationwide unmet need for ophthalmic medical personnel. In South Florida, there are more than 600 positions potentially for physician's assistants for ophthalmologists that remain unfilled. So I decided to do something about it. By starting the first ophthalmic medical technology program at Palm Beach State College in Palm Beach Gardens, Florida, we have trained more than 60 OMTs who are now working in the field with ophthalmologists to help restore sight. There's nothing more satisfying than getting your vision back.